All right, let's go ahead and open up the doors. Hello, everybody, and welcome to Daily with Doc. My name is Becca Dukes, and I have with me the good doctor himself, Dr. And we are ready for some, we're ready for some fun, right, Doc? So we like to make learning fun. Folks, health does not have to be complicated. It actually is pretty simple. The body does amazing things all on its own, but we have to make sure that it has what it needs in order to do those things all on its own. And when it doesn't have it, that's probably more than possible, the reason why you might be having some poor health, discomfort, or conditions. So on Daily with Doc, our whole goal is to make sure that we provide you with things that you can put in your toolbox to help yourself in making sure that you have what you need to not just survive. Okay, RDA. I can't remember at the moment what it means, but it's like barely surviving.
Recommended daily allowance.
Well, I know that, Dr. Wallach, but the other definition for RDA, which is not quite recommended daily allowance, just rarely dead something. Anyways, we're all about thriving. Okay, those recommended daily allowances are just enough to keep you alive, and we're about thriving, and that's what we're going to be sharing with you today on Daily with Doc. My name is Becca Dukes, and I am excited to be the hostess of this program. We have been going now daily since the beginning of the year, and with Dr. Wallach just over 3 years on a regular basis, as we have gone through a couple different platform changes and name changes and day and time changes. It's been absolutely fantastic that we are able to evolve with everything that's going on, everything that's coming at us, even those things that are trying to stop us from being able to get this message out. Well, folks, we even love the haters. So because of those people, it has driven Dr. Wallach longer and harder, and he's pulling me along with him. So I'm excited to be on this journey and to share this information with all of you. Just as a reminder, the FDA does require us to let you know that our program is not meant to take the place of your primary care physician. Our products are not meant to treat, diagnose, or cure any disease. But folks, like I said, when you give your body what it needs, it can do some amazing things. And Dr. Wallach and his attorney have actually sued the FDA and won when it comes to nutrition and being able to, say 8 times, 8 times, say that supplementation is required for specific conditions, and also to get specific nutrients added to our baby formulas. I remember, Dr. Wallach, when there was a time where sudden infant crib death was very, it was scary. Like when I had my oldest, I talked about it all the time, and I was like panicked. I didn't want him sleeping in his crib because I didn't want him to die. And then, go ahead.
I've been here. That doctors blame crib death on mothers laying on the babies and suffocating the babies. They didn't know the answer, so they didn't want to say, I don't know. So they blamed it on the mothers. And so many young women committed suicide because their family disowned them because their baby died of sudden death syndrome, and they're blaming the mothers for laying on the babies and suffocating them, which wasn't true. That shows you how really far off the track that the medical system was. Well, that's one of the I think probably 5 of those 8 lawsuits were to get the nutrients into the baby formulas, Enfamil, Similac, and the like. And we did. And within 90 days after the ruling went out, sudden death syndrome disappeared.
And I think that's absolutely fantastic. Occasionally we'll hear about something, Dr. Wallach, but not nearly as often as we did before.
Once a year is a lot different than
Well, even once a month is a lot different than 300 a month because not everybody has gotten the message, Dr. Wallach, and that's why we do this program. And folks, if you were shared this program by somebody specific, they shared it with you intentionally. There's a reason for you to be here. What you're going to hear today is going to spark either an interest in what you can do for yourself or get somebody else on your mind and say, oh, they could probably benefit from this information too. So we encourage you, one, to get back with the person that shared this program with you and thank them for sharing this program with you. And two, take notes because this could be life-changing for you as it was for me and many of my co-hosts. And share this program with others. If there is anybody that you can think of as you're going through and listening to this program, whether you're here live with us, with our live audience, watching a replay, do a comment. Especially if you're on a replay or watching the live stream, comment. Let us know where you're in from. Make sure that you are following Critical Health News on YouTube and Rumble and on Facebook. We're just Critical Health. Make sure that you are following us, subscribe to our channels, and share, folks. That's the way that we are going to be able to heal the world. And Dr. Wallach has this amazing crusade that we're on in working together to do just that, because it's not a one-man army, is it, Dr. Wallach?
No, that'd be impossible. There's only one man, is a good Lord. And so we had to have a whole army here on earth, thousands of people in each country, getting the message out there and making sure everybody's getting the right stuff.
And countries, I mean, right now, as our co-host team, we've got pretty heavy here in the United States, but we've also got South Africa with us, folks. We don't have any when it comes to getting products to different countries. But if you are listening from anywhere around the world, we're not leaving you out. Make sure that you get back with the person that shared this program with you. If there's nobody to thank, go to our website, dailywithdoc.com, and you will find a contact option. Use that contact option to send us an email. Let us know. One, do you have conditions that you want to address? Two, do you know people that you want to help also? Three, who shared the program with you? And four, do you want to join us on this crusade? It doesn't have to be in that order. We just want to get that information so that we know how best to meet you where you're at, so that we can be instrumental and used by God to be able to touch more and more lives. Wallach, I just want to make sure that everybody knows that if you are here live with us, use that raise hand option. You can find it in the Zoom menu under reactions. If you are out on YouTube, Rumble, or Facebook, and you would like to join us live, you may do so by going to dailywithdoczoom.com. That's dailywithdoczoom.com. So without further ado, it is my honor and privilege to introduce to you a gentleman who started out with some little issues of his own. And no, but 20 doctors couldn't figure it out. Well, he got to looking at what he was feeding the farm animals. As a farm kid myself, I understand that. In fact, I was looking at labels better than I was looking at my own food. And none of those animals were having issues. So he started eating what they had, and that was just the beginning to some amazing discoveries. He was getting his Bachelor of Science in Agriculture. He became a doctor of veterinary medicine. His research then took him around the world and even saved the white rhino from extinction. And now he's working on saving humankind from extinction as a naturopathic physician and the founder of a company called Longevity. So Dr. Joel Wallach, welcome to Daily with Doc.
Well, thank you so much, Rebecca, for the kind introduction, and thank you for all the great things you do and all the information you share with people around the world. I know you're up many times all night to dealing with people in Africa and Europe and so forth, and so you're doing a great job. Thank you, thank you, thank you. Well, today I briefly want to talk about something that's starting to really increase in numbers rapidly, and that is Parkinson's. Parkinson's disease. Doctors think of this as kind of an aging disease. No, it's a simple nutritional deficiency disease. In America alone, each year we spend $52 billion. I want you to remember that figure: $52 billion a year just to treat the symptoms of Parkinson's disease in America alone. Let's see here in North America, which includes Canada, the United States, and Mexico, there's 1 million diagnosed cases of Parkinson's disease. We have half of that. Of the 1 million, we have 500,000, and the other 500,000 is shared by Mexico and Canada. Okay, then let's see, there's 50,000 new cases diagnosed in the United States each year, Parkinson's disease, 50,000 new cases each year. And the death rate from Parkinson's disease in the United States each year is now at 37,500. Not good, okay? And this is all just a simple nutritional deficiency disease. And the disease attacks a very specific part of the brain, okay, the substantia nigra. It's called substantia nigra because there's a little brown, and it's kind of the midbrain. And it depending on what part you're looking at, it ranges from 25 to 50% cholesterol. Cholesterol is your buddy here, cholesterol you want. Okay, or the medical profession has demonized cholesterol. Well, it makes up your entire brain at least 25 to 30, 40, 50%, depending on the part of the brain you're looking at, and makes up 95% of male testosterone hormones and 95% of estrogen hormones for females. So cholesterol is very, very important in our daily lives and how we function in biology and life and amongst other people, okay? Very, very important. And so it's one of those things where, what do we do here? Well, we do have, the 90 essential nutrients, a healthy start pack, which is our sort of beginning of the 90 essential nutrients, 60 minerals, 16 vitamins, 12 minerals, 3 fatty acids. And then we have specifically for the, okay, that we get from cholesterol, we have synaptive. Okay, I take 3 of those twice a day. That helps the brain cells talk to each other and talk to the spinal cord, and the spinal cord talk to the brain cells and so forth. We also have I-26. I like the chewables. They come in chewables. I like the vanilla ice cream one. There's also a banana coconut one, I think, chewable. But there's also a powder and capsules. And so you really should be taking 3 doses a day of the I-26 to maintain that part of the brain, which is imperative, okay, for your brain to function and not get Parkinson's disease. We're talking about the substantia nigra. Substantia nigra is the name of that part of the brain, the midbrain, okay? Then let's see here. Also, I looked around and sure enough, I found the country that has the lowest rate of Parkinson's disease. The Philippines have the lowest rate of any of the industrialized nations of Parkinson's disease. And it's because they have a dish, okay, which they created. It's called flan de leche. It's a mixture of either soft poached or soft scrambled eggs and milk. Okay, they'll have it for 1 or 2 meals a day, or they might have it for a dessert after 2 meals. Okay, and because they're getting that cholesterol that way, they have, amongst all the nations in the industrialized world, the lowest rate of Parkinson's disease. It's not a genetic thing they have. It's not an autoimmune thing that they have. It's a dietary thing they have. And so we spent a lot of time digging around and looking around and why were the Filipinos so low with Parkinson's disease? It's their flan de leche. Okay, flan de leche. You can look it up and it'll blow your mind. And so we've been doing this for a long time, eating the eggs. I eat 3 eggs for breakfast, 3 eggs for dinner time, soft scrambled in butter. No margarine. Of let's see here. I also have the usually red meat or fish. Okay, with the eggs for breakfast and dinner, and in the last couple of days we've been having salmon. Okay, and we also have let's see, salmon. We'll have what's another good one we have, Rebecca?
Whitefin tuna.
Tuna. There you go. Tuna.
Or, yeah.
Yeah.
So steak and eggs is okay.
But yeah, just you can't fry anything. No frying. No frying. And just remember, the I-26 and the synaptive, along with the 90 essential nutrients, are going to give your body what it needs from a supplement standpoint. But you still need to eat your eggs and your fish and your red meat. And at the percentages of vegetarians who have Parkinson's disease versus meat eaters, okay, who have Parkinson's disease. So it'll be very interesting to check that out. I'll have that for you tomorrow. Okay, and so it's one of those things where this is not difficult. And if you're taking all these nutrients, you are going to reduce your risk of getting 600 different diseases. If you're not taking these nutrients, your risk, especially if you're eating badly, you're having carbonated drinks, you're eating fried foods like, fried chicken, fried fish, stir fries of all kinds, and fried beans, and all that does bad things to the mechanics and the chemistry of all your cells, your tissues, and your organs, your systems. And so this is why these things run in families. It's not a genetic thing. It's because most families, grandmas and aunties and moms and dads determine, what food is served. And then the babies grow up, same thing. Okay. And so all the brothers and sisters are serving the same thing. And so that's why diseases run in families. It's not a genetic thing. There are no genetically transmitted diseases. I'll repeat that. There are no genetically transmitted diseases. Okay. It's our poor choices, okay, and lack of nutrition in our food. Nutritional minerals are not made by plants. Plants make vitamins, amino acids, fatty acids, but plants do not make minerals. Nutritional minerals do not occur in a uniform blanket around the crust of the earth. They occur in veins like gold and silver. And so the only way you're going to guarantee you're going to get everything you need is to consciously put it in your mouth. And it's going to cost you, if you just do the basic program and a couple of secret sauces, depending on what diseases your family gets, it might cost you 10 or 15 bucks a day. But if you're buying Starbucks coffee, you're spending that much money for 2 or 3 cups of Starbucks coffee. So you can't complain about that. To add 25 to 50 healthful years to your life, come on, okay? And so I'm excited about this because people are kind of latching onto this and getting more and more traction in the media, okay, in other countries. And because they're looking at what's going on here, because their rate of Parkinson's disease is going up. Okay, why is that? Go ahead, Becca.
Well, I was gonna say,
Designed for Parkinson's disease. And in 75 days, I always say, give me 90 days, 2.5 months, 75 days. She went in for her test, her annual test, which she'd been doing for 12 years. That was her 12th year. And they said, oh, we got to run this again. Oh, okay. Keep
yeah,
doing
so
it. We'll see you next year.
yes, they go through motor skills, a battery of, physical testing, not so much blood work, to see what symptoms are present. And all of the symptoms that she was experiencing 11 years ago, and even up until earlier this year, she no longer had. So we're talking tremors, both hands, face, then the head. I mean, all of these different things, affecting her gait. Just, she's so happy. She is so happy, Dr. Wallach. So I can't wait until we are officially able to share more of her story, but you're not even supposed to mention her name right now.
Okay, we're getting little pieces together here. And this is going to be very, very exciting because we have the tools, we have the knowledge of what questions to ask, okay? And even if they won't give us any records or anything, because I think they're holding back the records. I don't know why.
Let's not even go there. Let's just continue because we have hands up, Dr. Wallach. And when it comes to those minerals, okay, I like to use that analogy of chocolate ripple ice cream. People have seen chocolate ripple ice cream, then they have veins of gold and silver. I mean, I've got my silver and my gold and stuff that I wear. I never saw it in the earth before it was dug. So let's go ahead and get on with the show, Dr. Wallach. Thank you so much for that opening. It's amazing what the body can do. And it's really amazing how when nutrients are missing, they can be the underlying cause. And this is just like 90 nutrients, folks. Underlying cause of over 600 different poor health conditions. Probably more if we did an actual count, because there's more and more dis-ease that's being added to those lists with all of these fancy names where, even just sore muscles have 3 different names that I know of. But yeah, let's just work on helping people, Dr. Wallach, and help them be able to feel better. So let's go to our first hand that is up, and Courtney, go ahead and unmute yourself. Welcome to Daily with Doc. Try now.
Hi, Rebecca. Hi, Dr. Wallach.
Hey.
I have a question today about a female that is 91, 160 pounds, 5'4", and she has high blood pressure and is having sleeping problems, waking up at like 4 a.m. in the morning.
Now, does she urinate when she wakes up, or does she just wake up?
She didn't mention the urinating, but she does have incontinence problems.
Okay, so she does have urine problems. Okay. Well, the odds are at 91 years of age, she has osteoporosis of the skull. Okay. And I think there's like 37 different diseases you can get, including nocturia, where you wake up at night to urinate, and during the day, you urinate 6, 8, 10 times instead of 2 or 3 like you're supposed to. Okay. And high blood pressure can be due to several different things. Okay. And so let's kind of go with this. 160 pounds. She needs to get rid of all the bad foods: no fried foods, no processed meats, no oils, no glutens, no wheat and barley, rye, oats, no buckwheat, no sugar, no carbonated drinks. The diet drinks got to go, and also carbonated water, because they neutralize stomach acids, so you cannot absorb minerals and digest food. And then at 160 pounds, I want her to have 2 healthy brain and heart packs a month. If that's too expensive for her, she can have 2 healthy start packs per month. That'll be 90 essential nutrients. Right? When you have these issues, especially at her age, I want her to have the bigger hammer So if she can afford it, I'd have her take the 2 healthy brain and heart packs a month, full dose everything twice a day. She also needs the MSM. I want her to have the MSM. She can take 2 bottles a month of MSM. So she can take 3 at breakfast, 3 at lunch, 3 at dinner time. That's going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, blood vessel walls, and all this kind of stuff. Also, because she has high blood pressure, I want her to have the Ultimate Daily Classic tablets. Ultimate Daily Classic tablets. She can take 3 at breakfast, 3 at dinner time, or 2, 2, and 2 for a total of 6 a day. 2 bottles a month. They're kind of small bottles. And if she's on medication for high blood pressure, don't cold turkey off of it. But as her blood pressure begins to come down, she can slowly reduce the medication based on the numbers. Okay. And also, we want her to have, because of her age, we want her to have the I-26. She could have 2 servings a day, whether it's the pills or the powder or the chewables. I like the chewables myself. And that's going to help her maintain her brain, her brain issues. Okay. This is going to take care of her substantia nigra. Okay. Substantia nigra. Okay. That's going to help her with her brain working so she doesn't get things like Parkinson's disease. All right. And if she doesn't have diabetes, that's good. But if she does have diabetes, she can take her sweeties and take 3 of those twice a day. Don't cold turkey off of any medication, but as the blood sugar begins to drop, she can slowly reduce the medication. This stuff happens very quickly in a positive way. The body, even at 91, I've dealt with people who are 105 years old. Okay. And it's one of those things where when you look at the Humzas, their life expectancy is 120, and many live to be 130, 140, 150. And that's because they're getting all these nutrients coming down in the land flowing with milk and honey because of the glaciers up in the mountains grinding up the rocks, and the rock dust is white, makes the streams look white coming down. And they use this, and it just so happens that their glacial milk has more minerals in it than any other glacial milk on Earth. And that's why they live, their life expectancy is 120. They don't have a single medical doctor. We have the best medical doctors on Earth. Just ask them. Okay. And yet our life expectancy is only what it's like 75. Okay. That's not good. Okay. Ours is only 75. Theirs is 120. Okay. So I want to do what they do. Okay. So keep in touch with us, Courtney. Okay. And we'll walk you and your friend through this. Okay.
Thank you.
God bless.
You too.
Right. Thank you so much, Courtney and Dr. Wallach. It's not about dealing with people. We are blessed to be able to be around people, all ages, right? So that's the way I look at it. And we have a question, Dr. Wallach, and this is going back to Parkinson's. You were saying in one of the shows, it says that you were saying that there was a side effect or a condition called peel rolling. And do you remember that?
Yes.
They were wanting to know, what is the nutrient that would be, is that a connective tissue? I don't want to go into specific nutrients because it's not just one.
This is what it looks like. We sit there talking and be doing this. This is called pill rolling.
Okay.
Okay.
So is that nervous?
It's part of the myelin in the brain is going away. Okay. Because it's not getting the stuff that it needs to maintain the myelin. Again, we're talking about the collagen peptides, we're talking about the I-26. Okay, we're talking about the synaptive, all this stuff makes the connections work, the brain cells work, and that pill rolling can go away in 2 weeks. I don't care if you've been doing it for 20 years. That'll go away in 2 weeks. It's very quickly.
All right, thank you so much for that. And then I have another question here, Dr. Wallach. We have an individual who's another older person. I love it. 97 years old. They're 120 pounds, but they have a kidney infection, and they also are asking for your recommendations because there's a diagnosis of dementia or sundowning. Are you familiar with sundowning, Dr. Wallach?
Well, as the name implies, when the sun goes down, you can't name your own name. Okay. Okay. It's kind of a variation on Parkinson's disease, MS, multiple sclerosis, all this kind of stuff. Okay. Sundowning. Okay. And so when the sun goes down, you can't function anymore. Okay. And it has to do again with the white matter in the brain. Okay. And this is something that it's called myelin, okay, the white matter in the brain. And it's one of those things where you got to take care of the white matter in the brain, because that's what keeps your brain happy. It supports all your cells. It offers protection against all kinds of stuff, including infections and autoimmune diseases and diseases of aging and everything like that. So here's where again the let's see here. You need to make sure you're taking the 90 essential nutrients. You take the synaptive. You take the I-26. I like 3 eggs twice a day. And I like the variation. Sometimes there's nothing better than 3 soft scrambled eggs with butter. Okay. And then sometimes I like the 3 soft poached, and I'll separate out the yolk and with a spoon, and then just, put the yolk in my mouth before it breaks, and chew it up and swallow it. And then I have all that white matter from the egg. I have to chop that up and eat that. But I do this twice a day. Okay, because I'm also taking the I-26, and I'm also taking the synaptive along with my 90 essential nutrients and my chewables and all that kind of stuff. It's one of those things where you've really got to say, okay, if you want to live to be 105, 110, 120, 130, 140, 150, you're going to have to make that a priority. You're going to have to say, I'm not going to go to the movies 3 nights a week. Okay. I might just turn on an old movie on TV.
Wait. What do movies have anything to do with you living longer, Doc? Because I love going to the movies.
Money. Costs money.
So you're referring to making changes in lifestyle so that you can afford your supplements.
That's correct.
I thought you were going to go towards like the candy and the popcorn and the soda.
No.
Or just staying away from people. I like people, Dr. Wallach.
No. People are good. Okay.
Just wanted to make sure we were clear on that one.
There's no sense to live a long time if you're by yourself.
That's right. Absolutely right. Well, Dr. Wallach, we have a question. Okay, can you put your veterinarian hat on for a minute? Because we have a question from Susan on YouTube. She is asking about her 17-month-old puppy was just diagnosed with mast cell tumors. She's working on making homemade food with no grain or carbs. What else can she do?
Again,
So I don't wait on this puppy. But
that's all right. You go by, 10 pounds of body weight. We have Arthrodex. I'd start with Arthrodex. It's 1 scoop for 20 pounds of body weight. So it's a half a scoop for 10 pounds in a small puppy. Okay. And that's going to give a wide variety of vitamins and amino acids and fatty acids and minerals. Okay. I would also put maybe an ounce of water, an ounce of our liquid plant minerals in a quart of water. Put that in a little dish for the puppy to drink its water. And in the beginning, they may go, they might not like it, but they're going to have water, so they're going to drink it. Don't be so quick. Don't let them make them change their mind. Or you might cut the amount of liquid minerals from an ounce per quart to cut it down to a half ounce per quart, okay, to begin with. Okay. But these nutrients are absolutely essential in feeding puppies table scraps and that kind of thing. They may like it, but you're not going to have a healthy, long-lived friend.
So how about we have the mineral caps, Dr. Wallach, giving a mineral cap that snuck in into some food.
Yeah, that's fine.
Or some hamburger. And then one thing that I wanted to point out and I'm guilty of this myself, wanting to make sure that I didn't have any additives. I didn't want to have any fillers in my dog's foods. But when you look at how food is grown and raised, and if there's no minerals in the soil or the grass or the grain or whatever the animal is being fed is being fed, or where it grows, then it's not going to be in the food. So
That's right.
making
Plants only make vitamins, minerals, and fatty acids. Plants do not make minerals.
and then if you're looking at meats, you go towards the liver because that's where the minerals are. There's very few in meat itself. So making sure that you get this Arthrodex that has not just the minerals, but it also has vitamins and it also has enzymes to help with breaking down that food and keeping a healthy digestive system for our two and four-legged animals, because this can be fed to birds and lizards and snakes and rats and rabbits,
Monkeys.
monkeys. You just
Kids.
sprinkle on their food and there you go. So thank you so much for your question, Susan. Now, it has a mass tumor, Dr. Wallach. Is there anything extra that you would add for that? We
Well,
don't know if it's cancerous or not, but
yeah, I just start out with the um,
how
it's-
about maybe perpetual that has extra antioxidants in it and essential fatty acids for animals?
okay. Can't go wrong there. Can't go wrong there.
Yeah, or even a selenium.
Oh yeah, selenium's good. And of course, there's selenium in the Arthrodex,
Yeah.
and there's selenium in canned dog food and canned cat food. There's selenium in our minerals, plant minerals, whether they're in capsules or liquid. There's selenium there. So they're getting selenium from multiple directions if they're doing all the right stuff.
Right. If they're doing all the right stuff. So Susan, you've got some information to go from there. Hopefully that helped. And I have another question, Dr. Wallach, and just a reminder, folks, this is to my co-hosts, okay? If there are questions out there on YouTube, Facebook, or Rumble, I'm not seeing them today for some reason. So please make sure that you put them in the chat so that we can get to them as well, or send them to me via phone so that we can get to them also. Well, Dr. Wallach, we're going to go right back over to Courtney, who has another question. Dr. Wallach, an amazing coach helping people where they're at. Courtney, go ahead and unmute yourself, please.
Dr. Wallach, today I just came from a client who is 91. He's 6'4", and he was telling me he sometimes has trouble sleeping, and he thinks, well, he has actinic keratosis of the skin, so he's itching.
Okay, so is this the same one we talked about earlier today?
No, this is a man, and
Mhm.
he's 6'4", yeah.
Okay.
91.
Okay, so this guy here, he needs to get rid of all the bad foods. Okay, none of the bad foods. 2 healthy brain and heart packs per month. Okay, 2 healthy brain and heart packs a month, full dose of everything twice a day. And then I want him to take sleepies, take 2 or 3 doses of sleepies twice a day. Okay, and once, say, after dinner, and the next time, say a half hour, 10 minutes before sleep time. Okay, the skin, we also have, again, the MSM, don't forget the skin. I also like the hair, skin, and nails. Take 3 of those twice a day. That will actually help the skin considerably. Also, the collagen peptides, which has collagen from fish and poultry and sheep and beef. I take a scoop of that with my breakfast and drink and my evening drink. Okay, so I go through 2 of those small canisters per month. Okay, and that's going to help with the skin issues as well, because the skin is like 2/3 is collagen. The skin is the same stuff that's made out of, your tendons and ligaments and that kind of stuff. Okay.
Mhm.
So that'll help.
Okay,
But
thank you.
don't forget the 90.
Yeah.
Yeah, the EFAs are very important in that 90 also, aren't they, Dr. Wallach?
Mhm.
And all soft tissue. All right, thank you, Courtney.
Thank you.
So Dr. Wallach, we have a question here wanting to know what to take after a stroke. So explain to us what a stroke is and how that can possibly be a nutrient deficiency.
Okay, a stroke is caused by a blockage in an artery to the brain. Okay, so you don't get enough blood and oxygen and food and stuff like that. And so part of the brain will either be diminished in function or even die, okay, because of lack of blood supply. This can be caused by a blood clot. Okay, it can be caused by an artery wall getting thick, okay, because they're eating too many fried foods and the walls of the arteries are getting all that connective tissue in them, okay, oxidizing. So now instead of being 2 or 3 millimeters in diameter inside, it's maybe a quarter of a millimeter. And so it's very easy for a couple of red blood cells to join together and block it up and cause a blood clot, okay? So
And
that's
that's not cholesterol building up.
that's correct. Cholesterol and, well, not only cholesterol, it's connective tissue. It's more connective tissue than it's cholesterol. Cholesterol was kind of a misjudgment by the medical profession 100 years ago. Cholesterol is not your enemy. Cholesterol is your best friend. Okay, so it's not cholesterol that's causing blockages in the arteries. It's the fried foods you're eating. It's the salad dressings and it's the cooking oils you're using. That's what's causing the inflammation in your arteries, causing you to have plugging because of the inflammation causes the lining of the arteries to get thicker and thicker and thicker to kind of defend itself. Kind of like when you get a callus on your foot when you have a shoe that's too small wearing on your foot, you get a callus there. That's what's happening when you get plugging of the arteries. It's not cholesterol in your diet. Okay, it's what you're eating and how it's cooked and so forth. And the reason why we have so many troubles, such as Parkinson's disease, is because doctors have demonized cholesterol. And so people stay away from it. Well, depending on the part of your brain you're talking about, 25 to 50% of your brain is cholesterol. So it's like saying, okay, I'm going to give up all this cholesterol stuff and I don't mind missing 50% of my brain. That'd be pretty dumb.
Yeah,
But doctors keep pushing. I'm going to write you a prescription for these drugs, okay, to lower your cholesterol. And so take this drug, otherwise you will die from a blood clot. Well, it doesn't make sense, okay? It's no.
So what causes blood clots? The same thing, the fried foods?
Yes, it causes inflammation. And so your body's trying to defend itself by having the platelets, okay, which are made by your bone marrow and your red blood cells kind of joining together, trying to make things quiet in the lining of your arteries. And so instead of one, which might be okay, you start putting 8 and 10 and 12 and 15 and 20 in there and they form a blood clot.
So they start sticking together.
That's correct.
Blood clot. Okay.
It's not cholesterol.
So what would you recommend then for somebody that's 125 pounds? What would you recommend nutritionally to help after having a stroke?
Well, in addition to getting rid of all the bad foods, right? And they need the 90 essential nutrients. You also need the Ultimate Daily Classic tablets to support healthy blood flow through blocked arteries and support healthy blood pressure. That's what we came up with, the let's see here.
Brain and heart pack?
Well, the Healthy Brain and Heart Pack, but also the Ultimate Daily Classic tablets. Ultimate Daily Classic tablets. They're your big fighter. Ultimate Daily Classic tablets, you're a big fighter against blood clots.
Okay, so the Brain and Heart Pack and the Ultimate Daily Classic. Anything else? Or would you start there?
I'd start there.
All right. And folks, if you're listening to this and you're post-stroke, or how about Synaptive, Dr. Wallach?
I'm sorry?
Synaptive?
It takes Synaptive, but that's the brain cells talking to each other. Also, it doesn't hurt to take the, let's see here. Yeah, MSM. Okay, because it makes platelets. It also makes white blood cells. Okay, and so you're coming at this from many different directions. And so, you know, I'm 84, and I've never had a stroke. I've never had a blood clot in a leg or an arm or a finger or anything like that. Okay, I played a lot of rough sports. I was getting beat up in football, and I was getting beat up in wrestling. I was having my share of beating them up, but you know, this guy's trying to hurt you, and you're trying to pin him on the floor, or you're trying to move him out of the way so your runner can gain 10 yards or whatever it is. And so I took a lot of trauma. Okay, and then I was in the military and took a lot of trauma there. And so, but I never stopped taking my nutrients. Everybody used to laugh at me, boy, Wallach, you must be really sick. No, I said, I'm taking these so I don't get sick. They don't laugh at me. And then I said, whatever happened to Freddie? Oh, he died yesterday. Oh, he was the one who was picking on me all the time. Okay.
Yeah. Well, and Dr. Wallach, I have a question here for somebody wanting to know, what is the protocol for somebody that has been diagnosed with symptoms of a condition like Parkinson's per 100 pounds?
Okay, per 100 pounds, Parkinson's disease. Get rid of all the bad foods. Okay. 1 healthy brain and heart pack. 1 bottle of MSM. 1 canister of the collagen peptides. Let's see here. I would also throw in the Synaptive, 3 of those twice a day for 100 pounds. I'd also throw in the I-26, okay, to rebuild the cholesterol. Okay, it wouldn't hurt for them to have a couple of doses each day of the flan de leche. You know, that's a Filipino egg and dairy meal.
It's too good, Dr. Wallach, and it has lots of sugar. If I ate as much as I wanted, I'd probably gain some more weight, and I don't want to gain it back. But good stuff. It's good stuff. Even with half the sugar, folks. Flan de leche is really good. But the I-26, Dr. Wallach, I'm sorry for interrupting you, but it also helps with the gut flora so that your body has the right environment for those nutrients to be broken down and absorbed. And if there's pathogens that exist, the studies show that it actually takes care of those pathogens so that they're not working against you.
Oh, there you go.
I love the fact that it has that 25% of the RDA, but that's still not enough. You don't want to take it when you are eating your eggs.
Wait a minute, you didn't finish the sentence. It's 25% of the RDA, what?
Cholesterol.
Okay.
They
Okay.
do.
It's 25% of your daily, 1 dose of the I-26 gives you, and I take 3 doses a day, plus my 3 eggs twice a day. So I'm getting plenty of cholesterol. And that's why I'm 84 and I don't have any problems like that. I just have never had those problems because I started learning about this when I was 9. And it's one of those things where if you do all the right stuff, you can live to be 120 like the Humzas without a problem. They don't have any medical doctors, and they live to be 120.
Well, that does say something for an expensive medical system, doesn't it? We have a hand up. Let's go to Nancy, Dr. Wallach. Nancy, go ahead and unmute yourself.
Hi, Dr. Wallach.
Hi.
I'm wanting to know, my mother just came up with fibroids. I think those masses around the wall, the uterine wall. And she's wondering, what do you recommend? She's 180 pounds and she's about 60 years old.
Okay, get rid of all the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, no rhinos, no buckwheat, no sugar, no carbonated drinks. Even the diet drinks and the carbonated water need to go. And then 180 pounds, I wanted to have 2 healthy brain and heart packs per month, 2 healthy brain and heart packs per month, full dose everything twice a day. She needs 2 bottles of our MSM, so you can take 3 at breakfast, 3 at lunch, 3 at dinner time. That's going to help with cartilage and ligaments and tendons connective tissue, which includes the fibrous connective tissue in the uterus, would turn out to be fibroids if they're not happy. Okay. And then also, we want her to have our Xerafem. We want to have 3 of our Xerafem. That'll be 2 bottles a month of our Xerafem. Okay. And they give the raw materials for the ovaries to make all the wonderful hormones that you need, even if you're 60 years old and, you know, heading towards menopause and all this kind of stuff. You still need those hormones so that all the equipment works properly and maintains itself properly and so forth. And so the Xerafem works like a charm. We have the Xeratest for the males, and I take 3 of those twice a day myself. I take the Xeratest for guys for testosterone, and it tells the male equipment what to do to, you know, have a great sex life, but also how to make all the male parts happy and work longer and so forth. Same way with the females. So this is Xerafem. Okay.
Okay. So are these 3 different ones? I didn't catch everything you said. I'm trying to list them out here. So you got the Xerafem and the MSM.
And the Healthy Body, Brain, and Heart Pack.
Healthy Body, Brain.
And heart pack. Okay.
Okay, thank you.
You bet.
All right, thank you, Nancy. And Dr. Wallach, we are coming up. We're right at 12:51. We have one more hand up. Zach, do you have a quick question? Go ahead and unmute yourself.
Thank you. Dr. Wallach, you're amazing. You got my dad, 93-year-old, still alive. Everything you do is wonderful.
Thank you.
My father, they gave him Eliquis. He's 93. Overall, no diabetes, no high blood pressure, but they gave him because something related to his cardiologist. I just heard you mention Ultimate Daily Classic. Give it to him. That one is very important.
Yeah, Ultimate Daily Classic will help blood flow through blocked arteries and help support healthy blood pressure. Absolutely. And again, that's kind of the place to go. With that, that's in addition to the 90. That's not by itself, but that's in addition to the 90. And if money's a problem, you go with the Healthy Start Pack. If money's not an issue, I'd go with the Healthy Brain and Heart Pack. Okay. And don't forget, the heart does require nutrition. Okay. And so this is why we have the various heart programs we do have. Okay.
Thank you, Dr. Wallach. Thank you, Becca. You guys are wonderful. Thank you.
Thank you. God bless.
Not with us. Love you guys, all of you. Thank you, Dr. Wallach.
Bye.
Have a great trip to the Radio Land. We'll see you tomorrow. And folks, thank you so much for being here with us on Daily with Doc. If I could get my co-hosts up, that would be greatly appreciated as we leave Dr. Wallach in the waiting room, as he can then continue on with the radio program and not hear me talking. He hears that enough. But I just want to thank Sherry and Phyllis, both of them doing a great job, and Marilyn, my goodness. And we also have on with us Albert from South Africa, and we have Coach Rod on also, and we have AJ Sportis, who's here somewhere. There he is. Folks, I could not do this show without these people right here. So I want to make sure that I give them a major shout out, is letting people in the room, watching the chat, making sure that I see the comments, because I can't see them out on YouTube, Facebook, and Rumble today. So they're feeding me that information to keep the program going, plus dictating and doing that dictation here in the chat. So it was just one of the biggest advantages, folks, of being here live with us. on Daily with Doc. We are here Monday through Friday from 12 to 12:50 p.m. Pacific time, just so that you can join us live and ask your questions. Dr. Wallach used to do this on the radio program at this time, and that was kind of just faded away. And so we picked up the pieces and made it something that is live with video. And I'm bringing with us one of the starting couples who got Doc on the radio, and that is Phyllis and her husband, Andy. Amazing mentors in this whole longevity family. And folks, we all work together. We brought this program or put this program together as a resource for an amazing community. So if you were invited by somebody specific, make sure that you get back with them. Thank them for sharing this program with you. And also make sure that if you tell them where you're at, what you need, let them help you get the products you need in order to create the best health journey for you as well. Now, if there's nobody to thank, again, go to our website, dailywithdoc.com, and click on that Contact Us, subscribe to our newsletter. That's for everybody. But when you use that Contact Us, let us know how we can be of service to you as well. And we also have a call team for people that have never spoken to anybody about longevity and have not tried the longevity products. If you are brand new hearing this, or you've been listening for years, because we got a lot of people out there listening to Coast that have never tried the products, and they're thinking, okay, it's finally time. Please feel free to use our call number, 855-949-3377. So thank you again, all of you, for being here, for having my back, all of you that are here in the room, for taking the time and investing it into yourself so that you can help yourself or help somebody else. Until next time, bye for now.